Welcome back. Dr. Patrick Dakum joins us now. He is the CEO, Institute of Human Virology in Nigeria, also a public health physician. He joins us from Abuja. Good morning, doctor. Thank you for joining us today on the program. The last time you came, ever since then till today, the numbers have since spiked, 131 now from the NCDC. What is your impression of how we're approaching this?
Well, thank you very much, Chamberlain, and good morning. I think it's very clear now that Nigerians do know that all that we've been describing related to this virus and its epidemiology, that is, I mean, the rate of infection is turning out to be what was predicted, meaning there's going to be a rise and a rise until it peaks, and then it flattens, and then it goes down. And we are beginning to see that rise now. By the time Mr. President did his speech, there were just 97 cases. Not just, but there were 97 cases. And just between when the speech was done and within 24, 30 hours, we have added close to about 30, and now at about 131. So it's rising, and with the rise comes the need for more drastic actions. That is why I think the containment measures that are being implemented now, if we can strengthen that a little bit more and enforce them, then I think we probably may flatten the curve earlier than what we expect. But all that we need to do differently is to be more aggressive. The methodology for containing this epidemic are things that are already well known. I always tell people that how to prevent infectious diseases is an age-long process, meaning ever since we have known that once somebody is infectious, you separate him. People that are close by move, people move a little bit far from that person, avoid contact as much as possible. And then the disease wears itself out, the person gets healed. That's the outcome we want. And then we move on. Whoever is sick, we treat. So the methodologies are known. So what we need to do is to cooperate with the relevant agencies in ensuring that we observe all that is being said. And I think that's what we need to be doing differently, the aggression with which we are approaching things. And let me say clearly that the fact that the infection has not been seen in certain states does not mean that those states will be resting on their oars. In public health, we always will sing the song, prevention is better than cure. There's a mantra in a local language that says, if you see the beards of your neighbor catching fire, what do you do to yours? You look for water and pour on your own beards. And that's what the states that yet do not report a case need to be doing. And I'm impressed with what I see in some of the states and the aggression with which they are taking it. You know, asking people to stay at home, staggered work system, all in a bid to ensure that in case a case comes up, that measures are already in place and people are already used to that.
About the numbers rising, peaking before we flatten the curve. Now, the NCDC did say yesterday about 6,000 persons they're trying to contact trace those people. And then part of the challenge too, those who are asymptomatic, those who don't have any idea, they feel good, they don't think there's anything wrong with them, but they do have it. So is it possible to forecast how, up until when do you think we're likely going to peak and then begin to flatten the curve, given that states are now, I mean, the lockdown in some states and how we're approaching it in different parts of the country?
My take is that in terms of when we think we are going to be able to peak, in the epicenters, for example, I see us going on for another couple of weeks. It's extremely difficult to predict. And like one of the experts that we have had the privilege of meeting at some points, that's Dr. Anthony Fauci, the director of NIH in the US, he keeps repeating it, that the timetable is dependent on the virus. The timetable is not dependent on us. It's not dependent on policymakers. It's not dependent on people just saying it. However, we have a role to play in order to flatten that curve. And the role we have to play is to be aggressive in stopping this virus from jumping from one person to the other. You won't get it from somebody who doesn't have it. Now, you've mentioned the issue of asymptomatic people. Yes, definitely there are people that may be asymptomatic or people who are mildly symptomatic. Because remember, like we've said always, that for coronavirus or the COVID-19 disease, 80% of folks will have a very mild symptom, meaning they will just have symptoms that just mimic the common cold and maybe some little difficulty in breathing, but something mild that they can cope with. And it doesn't mean they are not infectious. They are infectious, and they could pass it to another person. So it means then that since we do have possibility of transmission from asymptomatic people, even though such transmission is not very high, and I must say not very high, because I think we also run the risk of moving on to being very paranoid about our lives. So they could, and that's why everybody in the country, whether in an epicenter or not, need to observe social distancing, need to observe practical hygiene, washing of hands with soap and water, etc. I can see, for example, in the state I come from, I watch on TV, I talk to the healthcare providers and the public health people in Plateau, for example. I see the governor already instituting measures that I believe are measures that are aimed at people that are not necessarily, they don't have any symptoms. We may not 100% say that there are no cases in a place like Plateau. However, we can clearly say that there are measures that are being taken, including providing for isolation center in case, including, getting people to stay at home. These are the measures that we need to institute, even in places where the infection is still asymptomatic or where it has not been reported. And it's extremely important that we do all of that.
Said the other time that this virus does not depend on, well, this turning the curve, flattening the curve, turning the curve and all, doesn't depend on us, but depends on the virus. Now, you also mentioned that asymptomatic people are going about their normal lives now. NCDC gave that figure of 6,000 contacts that are being traced now, no doubt with difficulty. So we have a challenge of a database with which, the NCDC or government at various levels could have been able to do this a little more effectively. That's what some people are referencing happened in Asia, in China, for instance, where it was easier for people to be traced because they had a data bank. How do you see us tackling this challenge, seeing that 6,000 people, if we do the math exponentially, it could be, a lot more dire than we can imagine. So how do you suggest, how do you think government can tackle this challenge of contact tracing people that could be involved in all of this without them even knowing it?
Well, Ayo, let me state that, like a lot of other experts have said, we are dealing with a moving target in the sense that we are dealing with a virus that is new. We are dealing with learning about its behavior. We are learning about its behavior in different contexts. How it behaves in Europe, how it behaves in China may not necessarily be the same way it will replicate itself 100% in Africa or in Nigeria. Now, how we deal with contact tracing that number of people is there are what I would call urgent things to do, that is emergency actions now, and that is who are those that have been in contact or exposed to people that have been confirmed as positive. These are the people we should urgently be following up. Who are people that have are healthcare workers that have been in contact with taking care of people in the hospital or family members. As long as you have been in contact in the same environment, close environment with somebody that has tested positive, then you are a suspect that needs to be followed. Well, suspect, not in this case, they have done anything wrong, but suspect in the sense that you could have taken the virus by touching the surface that the person has touched, or being in close proximity when the person is talking with you, or shaking the hands of that person. These are close contact, and they are our immediate follow-up persons. And so when my good friend Chikwe, the NCDC director, was talking, he was mentioning the 6,000 as people that we do know have come in close contact with these index cases. Now, those are immediate things to do. Now, we can't follow up everyone that has been in close contact. It's not possible, but as much as possible, we should. It is also depends on the sincerity of the people. For example, if I have been in an aircraft, and in that aircraft, suddenly they say that somebody turned positive, even if NCDC does not contact me, I should also self-isolate myself, observe and see, treat myself as a suspect, and then ensure that I do not mingle with people just anyhow, because I could as well have been in very close contact with that person. I don't know where the person was sitting. So those are immediate things, and we should follow as many as we can. If somebody has been in a party, it's difficult to trace all the people that came to the party unless they bring themselves up. And so one of the calls that I believe NCDC and the government was ringing out is for, if you know that you have been in close contact and a person that you have had test positive, give yourself up. Now, these are immediate, urgent. Now, we need to also remember that as we deal with this virus, the structures that we put in place should be also structures that will be on the medium term. What are we going to be doing? On the medium term, we are going to be ensuring that we are multiplying the number of testing centers beyond even the one per state that we have all been recommending, beyond what it is. We should be involving the public-private sector in trying to ensure that their response is also coordinated. When we talk about X amount of test kits that have come, we should know that the test kits go to the lab, and as we scale up the lab, it should be scaled up not just in public sector, but we know that there are a lot of capacity also in some private sector that we need to scale up. These are like intermediate things: scaling up the testing centers, scaling up the isolation centers, and training healthcare personnel. Now,
just one moment before you continue. You said the other time that people who have been in close contact with some of these people, that some of these 6,000 people, some of the people that you mentioned in this under this category, that they should self-isolate. But then consider the possibility of some people who live in very, very constrained environments where it will be difficult for them to self-isolate. Definitely, it goes without saying that there is a possibility of that person spreading it out without even knowing. What happens in that context?
It's extremely difficult to quite put a rule as to what happens. But if I have been in contact, okay, let's say me and you, Chamberlain or Kaede over there, assuming we were in the same room here, and they suddenly, I suddenly call you and say, hey guys, I've tested positive. You know, what do you as IO need to do? First of all, you got to now go back home. You are living in a very close environment as much as possible. If you cannot leave that place to a different place, ensure that utensils that you use, put on a mask all through. You're staying in the house since you are very close and it's difficult to live. It's not easy to put a hard and fast rule as to what you should do, but as much as possible, avoid any contact. And if you can, stay in a room alone until these 14 days. Now, if I suddenly call and say, hey, hallelujah, I have now tested negative. They've done 1, 2, 3 tests and I'm negative. And therefore, you can continue with your social distancing like it is for the general population, but at least you are not going to be in a situation where you are self-isolating as such. So it's not an easy, hard and fast rule, but if generally in every home, have water, have soap, make sure that anyone that has cough there is protecting himself from others and protecting others from him. These measures within a family setting will be adequate. It's not easy sometimes if you say you are social distancing You got a granddaughter who just spits through the door and flies on you. What are you going to do? You know, but if you have been maintaining proper hygiene, then it makes it less likely that even if you had something, it will transmit. Now, let me also say something related to what we have I said earlier when I mentioned the fact that the timetable for this, the virus determines. But I also did say that if we play our roles right, we will limit the virus from doing what the damage it will have done if we had not done what we did. Meaning then that our own role then in slowing and flattening this curve is observing these things that we have mentioned. I'll give you an example. In my workplace, that's at the Institute of Human Virology, Nigeria. What we have done is, just like I saw on the channel's place here, immediately I walk in, they take my temperature. It is normal. When I came in here, my temperature was about 29.4 because I asked the guy, what is the reading? He showed me. I move in here, I got to your gate in here, I'm given, another person takes my temperature again. And I was like, wow, these guys think that my temperature spiked between there and there, but over precaution is better than no precaution. Now here in channels again, I was given a sanitizer to sanitize, even though, like, you know, I always walk about with mine, you know. Then by the time I sat down, the guy that came to ushered me in by just greeting. These are all measures that the general population were taking and we should take. So those things are different from what somebody who has tested positive will need to do. If you have tested positive, the measures that you will take are like complete self-isolation until when you are declared viral free, in the sense that you have been tested and you now can be told that, okay, now that you are well, the virus is no more circulating in your blood, you can relax. Relax in the sense, go back again to what the general population is doing. Before I forget, let me also go back to the other thing I was mentioning, and that is the need for us to have a long-term plan, apart from the immediate urgent and the intermediate, which I mentioned. As a country, whatever measures we are putting in place, we must put them in such a way that the next pandemic or the next epidemic will not meet us unprepared. What are those long-term measures that we're talking about? We're talking about the normal surveillance system. The NCDC is the agency responsible for coordinating surveillance for Nigeria. But the primary healthcare centers are where people go to first. So the question is, to what extent will the primary healthcare center detect that something is wrong? Let's get a lesson from China. In China, in Wuhan, a doctor was seeing his patients, normal day-to-day work. And then he suddenly noticed that here is a gentleman came with pneumonia, then his wife, then his other brother, 3 people from the same family with pneumonia that looks like the SARS curve that circulated some years back. What did he do? He immediately called the disease control center and said, hey, look, there's something I'm seeing here that is a bit higher than normal. Because that's what an epidemic is. You have people having diarrhea, vomiting, but once it gets higher than what the normal is there, we say it's an epidemic. Once it affects so many countries and becomes a global problem, we say a pandemic. So it means then that our surveillance system must be strengthened. I recall the Senate president, you know, with almost tears in his eyes when he first visited the isolation center. He said, well, monies were appropriated for this thing. What's going on? Why is it not there? Why are we coming up now when it is suddenly an emergency? Remember that we are coming from a history of tackling epidemics. We had the avian influenza. I hope you remember there was a time that when people see chicken, they start picking race, you know, because avian influenza was there. They say, this thing will finish people. Oh. Then we were able to get that out of the way by ensuring that both the veterinary people, the agri people, the health people all came together. Then we now have Ebola. And in the Ebola, I recall clearly that states were told to establish isolation centers. Well, where are they? The isolation centers were established for Ebola. What happened to them? So we need to have the presidential task force now asking those key questions, that any investment that we are putting here that is not an immediate urgent one, even if it is, how can we sustain it to go on and be useful if there is a future epidemic? So and apart from that, the research community, our institute, for instance, is working along with a lot of partners to yes, Kayode.
Right. Dr. Dakum, just a moment. Now, you have talked about the long-term plan, which is fantastic, and I look forward to, the government implementing this. But I'd like us to briefly explore an area which has not been talked about largely. So I look at the government strategy, and it spans across prevention, containment, and care, which is the three major areas. But then what about empowering people, as it were, to perhaps manage this personally? Because I don't look forward to a time when our isolation centers will be overwhelmed. In some other countries, if you test positive, you'll be asked to stay at home for a while and see if you start showing symptoms. So how about the government also explore, helping people learn how to manage this, just in case our isolation centers are overwhelmed and people actually need to manage this on their own? Should that be something we should be looking into?
Well, Kayode, that's a very good question. And it is something that is two-pronged, in my opinion. Two-pronged in the sense that there is a responsibility of government, there is a responsibility that lies on you and I. The responsibility of government is to give us the proper, accurate information, like we are currently doing with experts, etc. Pamphlets and information that is there. I know NCDC does have, a public relations or an awareness section on their website, and they bring out information. But this information is still way the distance between this information and the people is very wide, and so it needs to be bridged. Government on its own can activate all its organs in order to ensure that that is done. Remember when we had the HIV thing, anywhere you go, you saw billboards, you saw radio jingles. The man in the village has a radio. He listens. What are the channels that are common there? Let's put jingles, let's put all the information, education, and communication materials that will educate people in their language and in their own context. That's what government can do, provide us with but when government does that, I think communities do have a role. And those communities include the gatekeepers. And I've heard it said in some other program on channels too that the traditional rulers have a role, but they need accurate information. Remember now that we are also suffering from an information overdose. Information overdose that everybody on every WhatsApp group now is becoming an expert. So it means then that accurate, simple information, 4, 5, 6 steps on a pamphlet, that's all that we need. We don't need all the knowledge for the general population of how the virus is somersaulting, is doing this and that. No, we don't need all of that. We just need simple, what do I do? And if I am positive and I cannot go to the hospital because the hospital or I say is not ready, what do I do? I think the government can provide guidelines, which they already do have to some extent, down to the people. But let me tell you what myself and a couple of us have done. We had a chat with my governor, and I said, look, these are the areas that we need to pay attention. And of course, he said, oh, of course, and communities need to take action. I said, well, let me take action in my own community. And my community is somewhere in Pangshin local government, and what we now did with the tribe called Mopun is the Development Association set up a team. We got 3 doctors, 3 nurses, 3 pharmacists, and then we set them up, provided some little donations that we did as individuals for them to print materials, and they went village by village. They developed a jingle, information jingle in our language, and then we went village by village doing that. Now, that's the only way together that we can overtake this virus and get ahead of the curve and get ahead of it. That is, government give us the policy, give us the accurate information as developed by experts. You know, one of the things that I really took off from the president's speech was when he mentioned, I think it's in either the 20th or so of the paragraphs, where he did say that we will continue to listen to the experts and follow the guidelines that they have given us. I think if you have your president saying that to you, it gives the experts the leeway now to be able to be on the driver's seat as far as providing accurate information. But government can do all it can. As long as we, as individuals, as families and communities, will not take the message and take it right down, then it will be difficult. Now, the primary healthcare agency has a very, very key role when it comes to that community sensitization. Because remember that if the structures are working well, there is for every village a village development committee that is made up of the gatekeepers of that village, a village health committee, a district health committee. All these are committees that are established by the PHC structure in order to disseminate information, prevention, and then they have small health centers that they provide treatment. So it's a combo. Government playing its part, and we're playing our part. But what you have said is very important, that we as individuals and as communities need to take the destiny in our hands.
All right, then, fine place to let it go. We do appreciate your perspective this morning. Thank you very much indeed. Dr. Patrick Dakum is the CEO, Institute of Human Virology, Nigeria. Thank you for your time. We're back in a moment. Stay with us.